What's up, TUMNAD lectures? In this video, we are going to talk about fetal circulation part 2. If you find this video helpful at the end of it all, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. In the previous video, we looked about what we call fetal circulation before birth. And we are able to see how blood was coming from the maternal side through the placenta, and then it goes to what we call the growing fetus. But in this video, we are going to be mainly focusing on what we call what happens immediately after birth when the umbilical cord is cut. But before we go into the detail of the events that occur after birth, I want us first to go through a quick recap of what we talked about in the previous video about fetal circulation before birth. We said that the blood was starting from what we call this structure we are calling it the placenta, because the placenta during fetal life is everything. It serves like the lungs, serves like the kidneys. He is everything during fetal life. Okay. We said that the placenta is going to be providing that kind of the oxygen-rich blood from the maternal side, and that blood was passing through this red-like kind of the blood vessel, which we are calling the umbilical vein. We said that this umbilical vein was moving to this structure which we are calling the liver, and of course that we had this beautiful kind of the shunt that was making that this blood bypass what we call the liver. But however, we had a very small kind of the branch which was moving to the sinusoids for the growth of what we call the liver. But the majority of the blood was bypassing this kind of the liver direct from the umbilical vein direct to what we call to the inferior vena cava. And we said that this shunt was what we call the ductus venosus. We shall go ahead and see what happens when the umbilical cord is cut. What happens what we call the ductus venosus. Okay, and of course we said that this blood from the inferior vena cava is going to be joined by this blood coming from the lower parts of the growing fetus, and then all this blood is going to be dropping into what we call the right atrium. We said that in the right atrium, majority of the blood is going to be shunted to this kind of the structure we are calling the foramen ovale. And that kind of the process of the shunting of this blood to the foramen ovale was aided by this kind of a beautiful kind of the valve which you call the eustachian valve that directs this blood to pass through what we call the foramen ovale. But of course, we also have some blood coming from what we call the superior vena cava, which drops down to the right atrium, and then that little percentage of the blood, approximately around 20%, will flow into what we call the right ventricle. But we said that during fetal life, we are going to be having high pressures within the right side of the heart compared to the left side of the heart. And we said that the reason for that was because of hypoxic vasoconstriction in what you call happening in what you call the lungs. We said that this little blood from the right ventricle will be pushed through what you call the pulmonary trunk, and then it goes through what you call the pulmonary arteries. But because this blood cannot go to what you call to the lungs, it takes this beautiful kind of the shortcut, okay? And we call that this shortcut here is what we call the ductus arteriosus that connects what we call the pulmonary arteries direct what we call to the aorta, okay? And we said that the reason for that is because we don't want blood to go to the lungs, because during fetal life the lungs are not functional, okay? And then we said that approximately 70 to 80% of the blood was coursing from what we call foramen ovale to the left atrium, and of course the left atrium is going to be flowing down through what you call the bicuspid valve to the left ventricle, and then the left ventricle will squeeze this blood through what you call the aorta, and then it moves down as it's giving off different kind of the branches to be supplied different kind of the body tissue, and then eventually some of the blood will come over down here. We are going to be having a bifurcation. We're going to be having what you call the right common iliac artery and then the left common iliac artery, which are also going to be further breaking into what we call external iliac arteries and then internal iliac arteries. And we said on the internal iliac arteries, you're going to be having these beautiful kind of the arteries, which you're calling the umbilical, arteries that are going to be driving the blood, which is going to be having a lot of the waste and less of oxygen, approximately around 50%. And then it's driving it back to what we call to the placenta. Okay, so now that was a normal kind of the flow of what we call fetal circulation. So now in this video we are going to be now looking at what happens when this kind of the umbilical cord is cut. Okay, we are cutting off this kind of the umbilical cord, meaning that the placenta is no longer providing any help to the growing fetus. The fetus now is going to be surviving on its own. What's going to be happening when the baby is born is going to be taking its first beautiful kind of the breath. It's going to be breathing in like And of course, it is going to be followed by a beautiful kind of the cry. And that cry tells us that brand new oxygen has finally landed into the collapsed kind of the lung, and the lungs have now started to expand. And that kind of expansion is going to be making the chest become a bit painful, making the baby to make that kind of beautiful kind of the cry. Okay, so now that's what's going to be happening when the baby takes in the first breath. Now, before we go to the detail of what's going to be happening, I want us first talk about the pressure changes going to be happening on what we call both the right and then the left side of the heart after birth. After birth, we're going to be having, I want to assume that this one here is going to be now our alveolar sac. And then, of course, you're going to be having this beautiful kind of the pulmonary kind of the arteries which are going to be coming. Now, because the baby has taken the first breath, we expect to be having now an extensive amount of oxygen in the air sacs. Now, we said that before birth, because there was no oxygen in the alveolar sac, these kind of the pulmonary arteries, they were undergoing what we call vasoconstriction. But now, because we are going to be having now oxygen, because the baby has taken the first breath, what's going to be happening with the vasoconstriction? You're going to be now having an increase in what we call the diameter of the blood vessels, meaning that these kind of the pulmonary arteries are going to be now slightly dilating. Okay, meaning that we're going to be having now the dilatation of the pulmonary arteries on all over the kind of the lung parenchyma. Okay, so now if we have an increase in what we call the dilatation of this kind of the pulmonary arteries, it means we are going to be decreasing in what we call resistance. Okay, we're going to be decreasing in what we call resistance. If we decrease resistance, meaning that we are going to be now allowing blood to come to that kind of the area, because during fetal life we had a lot of the resistance in what we call in the lungs. But after birth, because of oxygen coming to what we call the air sacs, the pulmonary arteries are going to be dilating, and once they dilate, we are going to be reducing on what we call the resistance. Meaning that even also the pressures within the pulmonary arteries also going to be dropping. Okay, so now it means even also the pressure which was backing the right side of the heart is going to be generally dropping. Okay, and it's going to be dropping and dropping and dropping. And then finally, we're going to be having now the blood which is going to be now passing through what we call the pulmonary arteries, what we call the pulmonary arterioles, and then from what we call to the capillaries, and then finally to the venules, and then they convert to make what we call the veins. So now blood is going to be now passing through what we call the pulmonary veins, and then they come to what we call the left side of the heart. Meaning that you're going to be having now an extensive amount of the blood which is going to be coming to what we call to the left artery. Also, that one increases the pressures within the left side of the heart. Now, after birth, we are going to be having high pressures in the left side of the heart compared to what we call to the right side of the heart. And that one is so much important, because it's going to be helping us in the closure of some kind of different kind of the holes, especially this kind of the hole which we are calling the foramen ovale. Okay, now that we have seen that we are going to be having an extensive amount of the pressures in the left side of the heart, let's go ahead and now see what are those kind of events that are going to be happening after birth. We said that we cut now our umbilical cord. Now, when we cut our umbilical cord, meaning that we no longer need this kind of the umbilical vein, meaning that we need this kind of the umbilical vein to now start degenerating. Okay, this kind of the umbilical vein is going to start degenerating, because we no longer need it, and it's going to become a beautiful kind of the fibrotic tissue, which we shall talk about later. And of course, it's going to be what we call the ligamentum teres. Okay, then when we come over here, we had this beautiful kind of the shunt here, which was what we call the ductus venosus. Do we need it again? We don't need it again. And for that reason, it's going to be becoming a fibrotic tissue, which we are going to be calling what we call the ligamentum venosum. Okay. And then, of course, now we are going to be no longer having this kind of, we're no longer going to be having this kind of this shunt, what we call after birth. Okay. Now, when we come over here into what we call the right atrium, we had this beautiful kind of the hole, which we are calling the foramen ovale. Now, the question is, how is this kind of the foramen ovale going to be closing? Now, I want you first take you through on what we call arterioseptal embryological development. Now, these ones here are going to be what we call the left and then the right ventricle. But now we are going to be seeing how we are going to be creating this beautiful kind of the interarterial septum. Okay, that's what you're going to be looking at. Now, this tissue structure here, which is going to be in the center here, it is so much beautiful. It's what we call the septum intermedium. It's going to be coming as a result of what you call the fusion of what you call the superior and then the inferior endocardial cushions. When they come together, they make this beautiful kind of the tissue, which we call the septum intermedium. Okay. Something which is so much beautiful is that there is this beautiful kind of the tissue which is going to be growing from up, and then it grows towards what you call the septum intermedium. But it leaves a very small kind of the space, and this kind of the small opening which is going to be left between this kind of the tissue is going to be what you call the ostium primum. Now the question is, how do we call this kind of this tissue which is going to be growing as it's coming towards what you call the septum, what you call the septum intermedium? Now, this kind of the tissue here is what you call the septum primum. Okay, is what you call the septum primum. And then, of course, this kind of the small kind of the hole which is going to be left here. This one here is what we call the ostium primum. Okay, what we call the ostium primum. Now, eventually, you're going to be seeing now, as the growth continues, you're going to be seeing now this kind of the septum primum is going to be now growing, and then it completes a union between what we call the septum primum with what we call the septum intermedium. Now, eventually, following programmed cell death, we are going to be seeing death of some of the cells on what we call the septum primum, especially towards the end of what we call the septum primum around the end. When there's that kind of apoptotic death of those cells, which is programmed, they're going to be leading to the formation of this beautiful kind of the hole. Now, this hole which is now formed the second is what we call ostium, the ostium secundum. Okay, is what we call the ostium secundum. Now, another beautiful thing which happens is that you are going to be also having another kind of the beautiful tissue which is going to be growing starting from up here, and it grows, it tries to be like it is going to be overlapping this kind of the opening which we are calling the ostium secundum. And this beautiful kind of the structure here, this kind of the tissue which is growing to slightly overlap this kind of ostium secundum is what we call the septum secundum. Okay, so now this tissue here is what we call the septum secundum. It is such a beautiful kind of the tissue. Okay. Now, when you look on this kind of the septum secundum and you look on what we call the ostium secundum, there is this beautiful kind of the opening, meaning that our blood can be moving and then it passes through this opening and it comes this side. This beautiful kind of the opening is what we call the foramen ovale. What you are going to be seeing this side here, that is how the foramen ovale is going to be coming about. Now, something which is so much beautiful is that we say that after birth, we are going to be having an extensive amount of the pressures in the left side of the heart compared to what we call to the right side of the heart. Meaning that this blood, because we're going to be having a lot of the pressures within the left side of the heart, as this blood is trying to move towards the areas of low pressures, it is going to be causing this kind of the septum primum to fuse is what we call the septum secundum. And once it fuses, it's going to be creating something like this. So I have what we call the septum primum coming to fuse is what we call fusing with what we call the septum secundum. Now, once it fuses with what we call the septum secundum, we have now successfully closed what we call the foramen ovale, meaning that pressure difference generated in the left side of the heart after birth also contributes to the closure of this structure we are calling the foramen ovale. Okay. Now that we have seen how the foramen ovale is going to be closing to remain a fibrotic tissue, which we are calling the fossa ovalis. Okay, so you shall remain with what we call the fossa ovalis. Okay. Now, when we come back here, we are going to be seeing now that because you're going to be having an extensive amount of the pressure within the left side of the heart, meaning that as the left ventricle squeezes the blood through what we call the aorta, we are going to be having another kind of the beautiful kind of the flow, because this blood, which is now here in the aorta, will want now to enter through this kind of the opening to come to the areas of the low pressures, because we said that we are going to be having low pressures within the right ventricle, and even also shall have low pressures within what we call the pulmonary system. So now this blood will try to bypass this kind of the ductus arteriosus to come to what we call the pulmonary circulation. Now, but what happens that we need this kind of the ductus arteriosus also to close. Now the question is, how does it close? There are three things that this kind of ductus arteriosus is going to be sensitive of. Okay. Now the ductus arteriosus is going to be sensitive to three things. This is going to be ductus arteriosus. It is going to be sensitive to what we call oxygen. It is going to also to be sensitive to what we call bradykinins. It is also going to be sensitive to what we call prostaglandin E2. These are the three kind of the molecules that this kind of the ductus arteriosus is going to be so much sensitive. Now, for this ductus arteriosus to stay patent, it needs low levels of what we call oxygen, okay, to stay patent. It also needs low levels of what we call the bradykinins, but it needs high levels of what we call the prostaglandins. Okay. Now, during fetal life, you're going to be having low oxygen levels, low bradykinin, high prostaglandin E. These are the three factors that are making the ductus arteriosus to stay patent during fetal life. But after birth, you're going to be now having an extensive amount of oxygen. You're going to be now having an increase in what we call oxygen. We shall even have an increase in what we call bradykinins coming from what we call from the lungs. But we need low levels of what we call prostaglandin. And these three factors, the high levels of oxygen, high levels of bradykinins coming from what we call from the lungs, and low levels of prostaglandins are the one required for the closure of what we call the ductus arteriosus. Okay, it is such a beautiful thing. So now our ductus arteriosus is going to be closing the fact that you're going to be having high oxygen levels, high bradykinins, and low prostaglandins. Okay, and if this ductus arteriosus fails to close, we get a condition which we call patent ductus arteriosus. Okay, and there it can be surgically corrected, or even you may also give a beautiful kind of a drug which is called indomethacin, which is going to be blocking an enzyme called the cyclooxygenase. So now if you block this cyclooxygenase enzyme, you're also going to be reducing the levels of formation of what we call the prostaglandins E, and also that one is going to be favoring what we call the closure of what we call the ductus arteriosus. Okay. So now that's how the ductus arteriosus is going to be closed. Okay. It means that if we have now the ductus arteriosus closed, it means you're no longer going to be having blood which is going to be coming from what we call from the aorta to pass through what we call the ductus arteriosus, because now it has closed. Now we have completely separated what we call the pulmonary circulation from what we call the aortic blood flow. Okay, that one also makes a lot of sense. Okay. Now blood is going to be moving to what you call the descending aorta, and we said that when it reaches here, going to be having what you call the right common iliac arteries, the left common iliac arteries, which are also going to be branching to what you call the external iliac arteries and then internal iliac arteries. We said that you're going to be having what you call the internal iliac arteries giving off what we call the umbilical arteries. And of course, after birth, we no longer need what you call the umbilical arteries. Okay, so now we're also going to be having what you call the degeneration of what we call the umbilical, the umbilical arteries, because we no longer need them. Now, the question is, these kind of the umbilical arteries after birth, what do they turn into? Okay, that's what you're going to be looking at. What all these kind of the structures, what structure are they going to be turned into after birth? So now you're going to be looking on the events that happens after birth. Okay, so now we're going to be starting with what we call this beautiful kind of the vein which we are calling the umbilical vein. Okay, so now before it is what we call the umbilical, before it is what we call the umbilical vein. Now I want to see this umbilical vein after birth. What is it going to be turning into? It is going to be generally turning into what we call ligamentum, ligamentum teres. Okay, it's going to be turning into what we call ligamentum teres. That is the first kind of the event that happens after birth. The second one is going to be this beautiful structure here, which we are calling the ductus venosus. Now, this ductus venosus You're going to be having what we call the ductus, what we call the ductus venosus. And this ductus venosus, after birth, it is going to be turning into what we call ligamentum, ligamentum venosum. Okay, ligamentum venosum. Okay, and then another beautiful kind of the structure is going to be this what you're calling the foramen ovale. Okay, before what is what we call foramen, foramen ovale. Okay, but of course after birth it is going to be what we call the fossa ovalis. Okay, what we call the fossa ovalis. And then another beautiful structure is going to be what we call the ductus arteriosus. Before what is what we call the ductus, the ductus arteriosus. And then after birth, this structure is going to be becoming what we call ligamentum, arteriosum. Okay, ligamentum arteriosum. Okay, it's going to be becoming what we call ligamentum arteriosum. And then also we have another kind of the beautiful structure which we are calling the umbilical arteries. When they degenerate, what do they turn into? Okay, we also have, before we have what we call umbilical, we have what we call the umbilical arteries. Okay, umbilical arteries. Now, after birth, what do these umbilical arteries turn into? There are two things that are going to be coming from what we call the umbilical arteries. And the first one is what we call the medial umbilical ligament. Okay, medial umbilical ligament, and another one is going to be a beautiful kind of the artery that's going to be supplying the upper parts of what we call the urinary bladder, and that kind of the artery is what we call the spiria, vesco, the spiria vesco artery. Okay, it is also such another beautiful thing. Now, there is also another beautiful kind of the structure which we need to pay much attention to. There is a structure called the allantois, okay, which is going to be also in what you call umbilical cord. So now if you cut this kind of the umbilical cord and you have this kind of beautiful kind of the cross section. So now in this cross section, you're going to be having one kind of what we call the umbilical vein, okay, and also going to be having what we call the two umbilical arteries, okay, and then also we are also going to be having another beautiful kind of the structure which you are seeing here, which is a bit greenish, okay, and this structure here is what we call the allantois, okay, and also you're going to be having this beautiful kind of the jelly. Okay, now this structure here, which we are calling the allantois, it is going to be now turning into what we call the urachus. Okay, and then finally urachus will turn into what we call the median umbilical ligament. Okay, so now we are going to be having what we call the allantois, okay, which will turn into what we call the urachus. Okay, what we call the urachus, which will eventually turn into what we call median umbilical ligament. Okay, median umbilical ligament. Okay, so now these are the common kind of the events that are going to be happening after birth. Umbilical vein turning into ligamentum teres. Ductus venosus turning into what we call the ligamentum venosum. Foramen ovale turning into what we call the fossa ovalis. Ductus arteriosus turning into what we call ligamentum arteriosum. The umbilical arteries are going to be turning into two things: the medial umbilical ligament and then the spiria vesco artery, and then the allantois will turn into what we call the urachus, which later turns into what we call the median umbilical ligament. Okay, so now that briefly covers the events that are going to be happening after birth. Thank you very much for watching, and if you think whatever I've talked is really making sense, is adding to you, you're benefiting, please, you can hit the like button, comment down in the comment section, and please subscribe. As always, TUMNAD, until we meet next time.